right. Hello, everyone. Welcome to our Biodesign and Public Health series. I am Dr. Candice Carpenter. I'm one of the co-chief executive officers of BCPH, as well as the chief strategy officer and co-editor of the HPHR journal. I wanted to bounce this over to my colleague,
Hi,
Dr.
everyone. My name is,
Oh,
oh,
go ahead. Sorry.
perfect. Go, Dr. Lecomte.
Oh, hello. How are you? Welcome to today's webinar. Very excited to hear this amazing conversation that we're going to be having. My name is Dr. Circe Lecomte. I'm co-CEO with Dr. Carpenter of BCPH. And I'd like to hand it over to my other colleague.
Hi, everyone. My name is Emmy Dunsford Hernandez. I'm excited to be joining the BCPH webinar series, and I'm the UCLA Biodesign Hub Coordinator. Very excited.
All right. So first we'll go ahead and we'll introduce the Biodesign and Public Health series. So I know some of you are diehard webinar fans of everything BCPH webinar. This particular series happens to be for our 76th edition in the HPHR journal, blending public health with biodesign. And we'll really delve into that during a number of the different lectures that we'll have throughout the month of May. Today we have the Welfie Pathway to Equity and Innovation within Public Health. So very excited to bring that to you. But stay tuned for next week. We'll have Sonic Solutions addressing chronic pain and stress through biodesign. And then we'll have a couple others that we'll be sending out as mailers. So as I said before, another great series where we really delve into a lot of interesting aspects of intersectional public health that we as BCPH have not really delved into before. But without further ado, I'm going to pass this over back to Emmy to describe more about biodesign in case many of you don't know what it's about.
Thank you, Dr. Carpenter. So excited to be talking about UCLA Biodesign. And can we see my slides?
Yes.
Good. Okay, amazing. Hi, everybody. So for UCLA Biodesign, we wanted to start by saying that our accelerator applications are open. So UCLA Biodesign falls under the innovation branch of UCLA Health Hospital System, and we're dedicated to bringing value to patients through the development of novel clinical and medical technologies. We have 3 different tracks, and as of right now, our accelerator track is open for applications until June 30th. So we're very excited to be sharing the link. And these are our fellows. Let me see if I can advance. A little bit more about our mission. We are pioneering healthcare innovation, and we do this by bringing together people from the UCLA Health and UCLA in general ecosystem. We have partnerships with David Geffen School of Medicine, with the Clinical Translational Science Institute, and even UCLA Anderson School of Management as well, to get that interdisciplinary value for our fellows to be able to create these novel medical technologies. And here are some of our fellows and medical students. We also have a medical student track, so it's very special during boot camp. You can also see Dr. Carpenter on the left. I wanted to shout that out. And we are also having our applications open for UCLA Health Innovation Challenge, which is an opportunity for everyone from the community to be able to pitch ideas that will help improve patient outcomes. And I think this is particularly special because it doesn't require a background in medical technology or any clinical science background. You just have to witness a problem and want to speak up in a way that would help others. So we have our link there. This is for the UCLA Health track, and we have 3 different tracks. One of them is Scale Health Equity, Greatest Idea, and Invent Health Tech. So depending on your background and what you're most interested in, please apply to one of these tracks. And another picture of our fellows. And lastly, our UCLA Health Equity Accelerator, which is how we actually got acquainted with Dr. Stephen Moyo, who we're going to be hearing about. But here are some of the amazing mission-driven startups that we've had. And Tequity's purpose is to improve health outcomes in underserved communities, particularly in communities that are affected by disproportionate health problems. So this is a picture from recently. I believe this was December, right, Dr. Moyo? I think this was a great picture. Yeah. But yeah, let me stop sharing really quickly. But perfect. Thank you for that intro. And so now I want to introduce Dr. Stephen Moyo a little bit. Can everybody hear me? I know that. Okay, perfect. Sounds good. Dr. Moyo, thank you so much for joining us. He is a board certified physician and the CEO founder of Welfie. And a little bit on him is that he completed his residency training at Osler Internal Medicine Residency Program at the Johns Hopkins Hospital and obtained his medical doctorate from Michigan State University College of Human Medicine and a Bachelor of Science from McGill University in Quebec, Canada. Wow, that is a mouthful. I know that I could never introduce you as best as you can introduce you. So would you like to say a little intro, Dr. Moyo, about like what you've done, what you're currently doing?
Yeah, I'll give a little bit, I guess, about who I am and sort of what brings me to this work. So I like to say I'm a first-time founder, but a three-time immigrant. So I was born in Zambia, moved to the UK, grew up in Canada. So shout out to the McGill and north side of me, so to say. But I came down to the US for my medical training, did that at Michigan State, as you mentioned. And really, it was that medical training and the work that I did both at Michigan State, abroad with Michigan State, in Baltimore, and then frankly here in San Diego as well, which has brought me to this nexus point where I'm bringing in together not only my medical background, but my personal background as an immigrant, as a person of color, and then even my artistic background as we try to tackle issues around health equity and population and public health.
Excellent. Awesome. Thank you so much for that. Yeah. So a couple of things I wanted to just highlight on so that, Dr. Moyo is one of our first in the Biodesign and Public Health series. So thank you for leading the charge, Dr. Moyo. And then also wanted to say yes, because I actually am checking some of the audience members. And so we do have some entrepreneurs in the audience, and I think some budding entrepreneurs as well. I've seen some people. So definitely check out the UCLA Biodesign, the Tequity, the innovation challenges that Emmy mentioned as well. And Dr. Moyo, would you be open to people connecting with you through Welfie or any other means?
Yes, easiest place to find me is on LinkedIn, but you can also just email me. It's docmoyo@welfie.com. Very open to conversations with anybody who's on the same mission for improved health equity.
Excellent. Awesome. So the next thing we'll go ahead and do, Dr. Moy, if you wanted to pull up your screen. So you guys want to see what is Welfie. So we're going to go ahead and have a demo.
Awesome. So everybody seeing my screen? Wonderful. So I'll give a little context before I hit the play button here. Just to understand a little bit about Welfie, we really term Welfie as a health equity platform. And so what does that mean for us? It's about making sure that the most underserved communities, whether they be youth, women, people of color, are getting the essential health needs met. For us, it's a big focus on prevention, so health education, care coordination. And we actually focus on whole person and whole families. And one of our key philosophies is that you can best impact the family if you go bottom up through the youth. And so as we've engaged families, and we do that largely through K through 12 schools and pediatric health to center the youth in our intervention, we've been sort of called to address the youth mental health crisis that's happening in our community nationwide, and frankly, unfortunately, on a global scale. And so this is our intervention that we're bringing in the youth mental health space. It's one of sort of several products we have in line, but the one that we're closely focused on right now. And so I'll stop talking and hit play. If you guys can give me a thumbs up that the sound is working, and I'll circle back when it's all done. Hello, I'm Dr. Stephen Moyo, CEO and founder of Welfie. Today, you are going to get a special sneak peek at Vibes. Vibes is a social health community designed to connect youth to their peers and caring adults. Meet Maria, an 11-year-old girl in your school. For Maria, her day starts with a Welfie or a wellness selfie, a mental health check-in where she can share how she is doing. Today, Maria feels stressed. She can journal in her encrypted diary, and based on this information, we send her a vibe. A vibe is a short musical message that takes a student from where they are at to where they want to be. Vibes are fun and social. Teachers can assign a vibe to an individual student or a group of students. For example, for Maria, a vibe might sound like this.
I am that girl, I run the city, I run the world. Mine is a diamond, thoughts are a pearl. Yeah, I keep them shining, I keep them blinding. Hair keep on twining, that's what we do, that's my natural do, yeah.
When a vibe is recorded, students can remix it, making it their own, bringing their music, culture, and style to the beat. When creating a vibe, Maria is engaging in evidence-based interventions for mental health such as play, music, positive affirmations, and storytelling. When students opt in and parents consent, Welfie can analyze a vibe for video, audio, text, and voice, looking for early signs of emotional, physical, or mental health needs, and this data will be used to connect students to help. Based on a vibe, Welfie dives deep into the well, servicing resources that have been vetted and curated for youth by youth. Today, we have over 400 resources that include content, communities, and care providers. The well can be managed by a school or health professional to ensure that only high-quality vetted resources are available to their community. Care providers like a school nurse, counselor, or social worker can connect with students and parents, giving them increased access to care, resources, and knowledge. What teachers and parents tell us that they are most excited about is how Vibes shows up in the classroom. Every vibe that we create layers on health education. This health education aligns with the National Health Education Standards, so whether it is mental health, physical health, or even STEM, we provide students and teachers with a fun way to engage around health that fits into the school day or can be used by camps and after-school programs. If you want to find out more about how we are addressing school mental health, scan this code to connect. We'll see you soon. So I'll pause there, and that's what we're working on these days.
Excellent. Love that, Stephen. So the chat is open. So if people have questions, feel free to populate the Q&A or the chat as you see fit. And so we're going to go ahead and ask some deeper questions of Dr. Stephen. So Emmy, I'll have you kick it off.
That sounds amazing. And love watching that demo. I think it's like my third or fourth time after working with you on Tequity, but every single time like the song comes up, it is just dancing. Like it was great. Honestly, the first question that I'd want to kick it off with is how your individual story has influenced your way to creating Welfie, Dr. Moyo.
Yeah, absolutely. So I mentioned that while I was at Michigan State, one of the things I had the pleasure of being part of was a program called Leadership in Medicine for the Underserved. This was specifically students who sort of raised their hand and said, hey, I want to do more work with underserved communities. And what this program allowed us to do is work with communities like Saginaw, Michigan, Flint, Michigan, but also abroad, places like Peru and El Salvador. And through those experiences, I had the chance to work really closely with community health workers. I saw the trust that they had with underserved families. I saw the impact that they were able to have from a health education standpoint, coordinating care. And that always really stuck with me. So when I got to Hopkins and was in Baltimore, I started doing a lot of that work myself as a resident, sort of second, third year when things calmed down a little bit, getting out into the community, doing health education. And I brought that passion with me here to San Diego, where I practice as a hospitalist. But when I'm not in the hospital, I'm in the community doing this work. And is spending all of this time with community health workers and seeing that they just didn't have sort of the resources, the technology that they needed to really have more impact at scale, right? And to track that impact and sort of measure it and be able to report it back to the system. And I think that and sort of my knack for being a creative and wanting to solve problems sort of came together. I'd previously in the past founded some charities. And so when I saw this problem, it just started to sort of needle at me. And then I got bit by the entrepreneur bug around the same time and really founded Welfie with kind of two concepts in mind, which is one, how do we build tools around this community health worker to enable them to have this impact? But how do we also empower community members to care for themselves and each other? And so Welfie as a company, it stands for Wellness Selfie. It stands for this idea of that patient, that community member being able to take these regular snapshots of their own health by connecting their digital systems, answering surveys, putting in their data, being able to understand their health better because the system then educates you based on that. And if you need help, having that community health worker you can reach out to say, hey, the system's too complex, so I don't understand this, and then being a guide for you. So that's really how we came to the work. And it's really just been an exciting journey since we founded.
Yeah, absolutely. And I wanted to follow up on a few things, Stephen. So obviously Welfie's been around for a little bit, I think longer than BCPHS, because we're just coming into our third year. Feels like much longer. But I just wanted to get a sense of, what are the steps that you've taken besides Tequity to be able to help you grow Welfie?
Absolutely. In short, many. But I'll talk a bit about our journey. So when we started building Welfie, our first product was around cardiovascular disease. And so thinking about heart health, high blood pressure, diabetes, cholesterol, the whole aspects around cardiovascular health. we had built a product around that, which was the idea that people could take this Heart Health Welfie, understand their health and wellness, delivering education around these key pillars of cardiovascular disease prevention. And we were actually ready to kind of launch the product March of 2020. But along with the rest of the world, we were sort of hit with a left hook of the COVID-19 pandemic. And it was sort of after about a month or so of taking a look at this and sort of, I wouldn't say soul searching, but making sure we were staying to our mission, which is health equity, public health, kind of our focus. What did we want to do? We had this sort of fork in the road opportunity of say, keep pushing with, heart health and heart health promotion, or do we pivot and sort of build on what we built already and address the pandemic? So we made the decision to do that. We felt that the tool that we had built in terms of being able to sort of survey yourself, aggregate that data, provide that information to a community-based health worker or health leader could be utilized in the pandemic to allow communities to manage the pandemic. And so we had a rapid sort of iteration and build where we rapidly scaled up a COVID-19 sort of symptom survey, which then sort of through the pandemic progressed into testing tracking, vaccine tracking, public health education as well. And so that was a really key pivotal moment because I think two decisions were made then. One was not only to address the pandemic, but the community we wanted to focus on and sort of where. As we were thinking about cardiovascular health, it was more of we still wanted to impact the family, but it was more of a top-down focus on adults first. As we started to address the pandemic, we really took a look at sort of three different communities actually, which were businesses and how small and medium businesses needed to reopen, which is an important part of the economy, universities, which have also shut down, and then K through 12. And we realized very rapidly that K through 12 was the place that needed the most help, right? They had the least resources, and so it was going to impact the kids the most. And so with that equity sort of perspective on, we dove into K through 12. And it was around that time, actually, I was introduced to one of my co-founders, Susan McLennan. Susan's an Emmy Award-winning content creator for kids, and through her personal and professional experience, she has realized that the best way to sort of motivate and change the behaviors of a family is to do it bottom up through the child. And so she brought this, really 180 degrees sort of flip it on its head approach and redefinition of new philosophy for us to impact health and wellness. And so we really leaned into that in the K through 12 space.
That's amazing. And meeting Susan and all the videos that she's made, they're incredible too. Like,
yeah, she's a force. We're lucky to have her. And I think since she joined, and then also Lakshman, our other co-founder, just to sort of further answer your question, Dr. Carpenter, we've had really fantastic support from the community, both the entrepreneurial community, we're part of the Mass Challenge Health Tech initiative. We were one of the, I think it was 10 to 12 companies selected for Pandemic X, which was a federal sort of accelerator that happened around the pandemic. But then also from the sort of public health, public education side as well. We've had really great support from different organizations. And I think what is really galvanizing sort of healthcare, education, and sort of the public service space is just the fact that we are a mission-focused company, right? We start and end with this mission to impact underserved families. And I think when we open the door for that to be sort of how the table is set, a lot of people want to sit at that table, and that's been a really great and exciting opportunity for us.
thank you. Yeah, that makes perfect sense. And I guess following up on that, I wanted to ask a little bit about can you share examples of the innovative technologies that you're using with Welfie to improve these public health solutions?
Absolutely. One of the things that we think about is the kind of three pillars we focus on: health education, care coordination, and community health. And the care coordination piece, another way to think about it is access to care. And so as we step into this youth mental health space, there's different ways for us to solve kind of the spectrum of problems that are in youth mental health. So one aspect is we don't have enough youth mental health providers, right? And so one of the promises, frankly, of AI is to be able to decrease the amount of burden on the providers that we have, so we can actually increase capacity, not by increasing the volume of them, but increasing the amount of hours they can spend with a patient. So documentation is a massive issue for all clinicians. But I personally see, my wife's a clinical psychologist. My mom's a pediatrician. Her practice has transitioned to dealing with a lot of youth mental health. My best friend is a clinical psychologist. They spend hours and hours doing clinical documentation. And a lot of it is literally sort of manual work of looking back to past reports, writing out a report that is very similar to a report they may have written, obviously with nuance and other aspects for each patient. But there's a large part of that work that can be automated to some degree. And every psychologist that I've talked to, it has been them that have said, if this is done right, I can spend more time with patients. I can either see more patients or spend time communicating with patients, which really helps in two ways, right? One is a better patient experience, but two, it's a better provider experience. A lot of us do this work because we want to care for patients and we don't want to be writing notes for hours on end. And so when you have providers that are, more fulfilled because they're remembering and rekindling that passion because they're getting in front of patients and helping them, you're going to get providers who stay in the career longer. You're going to get providers who work harder, right? Because they're not as burdened and burnt out. And so in an interesting way, there's a really great opportunity for AI to actually increase access to care just by helping with documentation. And I shouldn't say just by, like it's a big thing. And so that's one of the things that, our CTO Lakshman has started to build already. The other key thing is matching people to care that we think is really important. The concept behind the Welfie is you get this health data, you get this personal data, not to aggregate and go off and do a Facebook maneuver and sell ads, but really to say, how do we match you to the right care at the right time, right? If you're dealing with anxiety and it's mild to moderate, you might not need to see a psychologist. Perhaps you need education and skill building. And if we match you to that right care, not only are you getting care earlier in the right care, but you're also decreasing the burden on the system. So this is how we're thinking about how do we utilize AI to not only match, but sort of decrease the work burden for the workforce as well.
Yeah, I definitely feel that with the decreasing of the administrative and paperwork, Dr. Stephen, for sure. And I know many of the providers on the call probably do as well. In terms of the matching that you're talking about, is it just the K through 12 that you're being able to match with the right provider depending on their anxiety or depression? Or are there other communities that can take advantage of Welfie, the wellness selfies?
Yeah, we're starting right now. I shouldn't say we're starting. We're definitely focused on youth mental health right now. But we really do see that as an opportunity to engage the whole family. And so the different communities that we do plan to target, aside from K through 12, obviously higher education as people become young adults, is really exciting. But as we think about the family, it's also how do you have the parent become part of the conversation? And I see this in my own life. I have a 3-year-old, but I think towards Susan's philosophy and our philosophy, there's things that I do for my son's health that I don't do for my own, but there's still these interaction points that matter, right? If I'm worried about my son's mental health, I'm also thinking about my own. If I'm worried about his nutrition, I'm also thinking about my own. And so as we educate youth about these aspects, we have the opportunity to educate their parents as well. And even though we step in to say, hey, mom, hey, dad, this is how you can care for your kid better. This is information that parents need to hear. And they're able to incorporate that into their own life anyways. And so we really see this opportunity and this duality to impact youth, but also the parents in the household at the same time.
I love that. And just a follow-up. So you showed us the demo of Welfie and how, say, if a student or a child is having certain kind of mood, then all of that data will get transferred back on whether or not they need to be matched with the provider. What is the ultimate vision of that wellness journey for the child itself? How long do you anticipate that they'll be utilizing this wellness app? Is it that you envision that, say, they start out in 4th grade, that they will take this on through, being a 12th grader and then eventually graduate as an adult?
Yeah, our vision that is lifelong. Health and wellness is a lifelong pursuit, right? It just changes depending on the era of your life that you're in. I think what we have lacked, not only in the US, but in Canada where I grew up, and I'd say internationally, as I sort of follow this field, is we have never really centered health and specifically wellness as a lifelong journey that everybody should be as educated about as possible, right? So our vision for the world is that Welfie is a tool that youth can be introduced to, frankly, as early as kindergarten, right? As we talk about kindness, empathy, understanding our emotions, all of those things, and that not only do they become sort of, what's the word I will look for, passionate about their own personal health through school, but it's something that carries with them throughout the rest of life. And so, one of the visions we have is that at the end of high school, everybody comes up with a health and wellness plan for themselves, right? Like, what are the values that I live by? What are the goals that I want for myself over the next 5 years? and how can this system help you achieve those goals? Because when I graduated high school, it was off to university, and it was all up to you to figure out, do I go to the gym? What do I eat? And all these things. And there's a reason there's a freshman 15, right? Nobody was there sort of helping you do that, and you get lost in the weeds of things. And so if you could have a tool that at different epochs of your life can help address, I think, those risk factors is really important. And so we see that opportunity with Welfie, is that we can be, frankly, a digital health platform for people throughout life.
Awesome. I love that. And I'm actually, Dr. Lecomte, I'm actually going to bring up a question that you and I have talked about extensively, especially in some of our other webinars. So Welfie is on a mobile platform. And if we're thinking about equity, I think about the most underserved and vulnerable communities that may not necessarily have access to a phone. And so when I'm thinking about the wellness journey, I'm like, the people who definitely need to be able to have that wellness journey and think about their values, their goals, their nutrition, their exercise, may not have access to Welfie. So I'm curious how you guys are addressing that.
No, that's a great question. We actually have started our journey being a web-based application. And so Welfie, the majority of what we've done around cardiovascular health, around COVID, has all been online. And that was intentional because of what you just said. Not everybody has access to a smartphone, the ability to download apps, data, et cetera.
Yeah.
So we'll always have that as kind of our baseline. Even as we move into what we're doing with Vibes and sort of building that out, there's an aspect of health education and how content gets sent out, where we're actually ideating how does this live not only in the school day, right, in a non-app based format, but how do we also get it out via SMS and email and all of these aspects where people do have more and more access without necessarily a mobile app being necessary. There's advantages to having a mobile app in terms of engagement, in terms of integration, different apps where we do think it's necessary, but we don't actually see it as the essential piece. Our goal is how do we reach as many people in as many ways as possible. And so it's really unique to sort of try to solve for this problem. I think a lot of companies, it's easy to be like, yeah, we're in the Apple Store and the Android Store and we're good. But I think if that's where we sort of drew the lines, we'd be failing a lot of people. And so, yeah, it's a great question. Is how do we live in the platforms that exist and people do have access to? I'll end with this, this is one of the reasons why we are really passionate about schools. In fact, is one of the silver linings, you can say, of the pandemic was starting to understand and close the digital divide. So more and more students and more schools and districts are sort of one student to one device, Chromebook or whatever the device might be. And so the ability to get into schools and have our education be on those devices is a way to actually reach more youth where they might not have access at home. And so that's kind of another way we're thinking about how do we get this out to as many people as possible.
And speaking of getting it out to as many people as possible, I want to ask about like current integrations with like high schools, middle schools. What is Welfie currently working on with regards to that?
Yeah, that's actually one of our big initiatives. We're really excited because serendipity, as I mentioned, I think people coming to the table. We were introduced to fantastic folks at Power School. Power School is one of the largest student information systems in the US. So we're integrating into Power School, into Schoology, to be able to reach more youth through that aspect. And we'll continue to expand sort of our school-based integrations there. We are a Google for Startups company. And so with not only the funding, but the sort of access to resources at Google that we have, we've really been able to make a sort of deeper relationship with Google for Education. So I mentioned the Chromebook platform. It reaches about 80 million students and teachers worldwide. So being in that Chromebook app space, in the education space, is really important for us. And then another key piece right now is we are planning to integrate into Epic, Cerner. We have a fantastic interoperability partner. So our dream is that this health education not only live in schools, but a physician, a pediatrician, psychologist can prescribe this health education to patients. And so we want to be in the places where youth are showing up, even camps, right? How do we get to youth through camps? And so we've actually been working really hard at that because I think it's one of the toughest things to do. Not to say it's easy to create amazing content. It's not. I've seen Susan do it, and it's very hard, very, very hard. But the other problem is how do you get it out? And so that's a lot of the work that we're also trying to solve for.
That's amazing. I wasn't sure, Dr. Lecomte, you were unmuted. I didn't know if you had a question.
No, I guess I was thinking about the app itself, and I didn't know how it was developed, if it's um developed in such a way that it's grounded as being a mobile website that is, turned into an app, or is it its own algorithm?
No, that's a great question. So to date, the web-based application is a mobile responsive web-based
Mhm.
app. What you sort of saw in the demo and the video with Vibes, we are really just in the early design and development stages for that mobile app. So that will be launched likely in the fall.
Okay.
The process that we're in, which I think is really important, is really just kind of going back to the drawing board and doing sort of deeper customer discovery and youth-centric design. We'll be doing sort of a sprint around that over the next month or so. We're co-developing, co-designing with youth. We'll be rapidly iterating and developing over the summer with youth, parents, schools, pediatric hospitals, all in the loop, giving us feedback with the goal to launch it in the fall.
So are you chronicling this process for publication so that other folks can replicate what you've done, or?
Yes, there are aspects that we'll actually chronicle and share on social media as we go through the bumps and lumps of all the process. I think the thing that we're trying to define is what are the aspects that are most important for us to chronicle. And the reason I say that is they're world leaders in human-centric and user-centric design, right? We'll follow their best practices. It's important for us to shine light on them. But when it comes to the aspects that we think are unique to us, those are aspects that we will be sharing.
Right. No, thank you very much for sharing that. So those are the things that came to mind as you were discussing your amazing journey here.
Yeah, thank you.
Yeah, absolutely. And the thing that's interesting, I saw a hand go up from the audience, and so I'm trying to like interpret how that is because the hand went up and now I don't see it. But I do see a question in the chat. So how much smartphone burden does the app potentially impose? Is it a light app? So I'm not sure how you want to take that one, Dr. Moyo.
Yeah, that's a great question. The answer, truthfully, is we won't know until we build it. I think there's aspects that we're thinking about in terms of how data gets computed and where it happens from a privacy standpoint. And there's also, certain advances in AI and things like that that are happening, whether we want to do certain things in the cloud versus do it what's called on the edge on the device to protect people's data. And so we're making some of those decisions right now. And I think the output of those decisions will determine whether you call it a light versus sort of a heavy app. So unfortunately, the jury's out. I do want to say that I do understand I think the thread of the conversation there, which is creating light apps means that, if you don't have the newest smartphone, it can still operate really well on an older version or, older generation. And I think that's an important aspect as we think about sort of equity in those aspects as well.
Awesome. Fantastic for describing that. I'm all about because I don't think the audience, not everybody knows light app versus heavy app. I know I don't, so I'm going to admit that up front. But kind of transitioning a little bit, Stephen, and this might be an interesting question for you. Are there any ethical considerations that you take that you think of when you're designing Welfie? Because you guys are doing a lot of iterating and prototyping and then obviously expansion. What are the things that you worry about besides what we've already discussed in terms of like the equity, in terms of who has that access to certain technologies?
Yeah, I think one of the things that comes up and sort of keeps me up at night is bias. We see it in our health and education, industries already. And as this race to AI happens, bias is already there, right? One is the data sets on which these models were built, right? So how do we build our data sets really important. A concrete example for that I'd love to give, and I'm challenging my team about, is as we think about how our AI helps with youth mental health provider documentation. For the providers out there, language that we might use is like patient is non-compliant medications, right? That's a really biased and loaded term. And when AI gets hold of that term and multiplies it across how many documents, right? And maybe adds different connotations and different words beside it, that can really perpetuate bias that really should start to be removed from the chart as opposed to multiplied. And so how we identify those things, think about the language that is used in documentation, train the AI to not use that language. If it sees that language, how do we replace it in a way that the meaning is conveyed but is unbiased or less biased? These are sort of ways that we're thinking about approaching the problem differently, as opposed to just running to a quick solution that's in the field. Because we want to be responsible with how we design the system. Because if you're going to scale these systems, you need to be knowing what they do and when they do it.
Yep, I completely concur. Another thing that Dr. LeCompte and I have talked about ad nauseum. But yeah, I'll pass it on to Emmy for the next one.
I honestly wanted to ask about how your accolades and awards, such as like the Google for Startups Black Founders Fund, and others, have advanced your mission and kind of like helped develop it.
Absolutely. One of the important things with each of these opportunities is the community that you become part of. And I think it's sometimes an undervalued aspect of sort of accelerators and incubators and different entrepreneurship groups and communities. You meet fantastic companies. You meet companies, especially in the space that we're in, that are also social impact companies, where you're like, hey, we're solving over here, but this thing that you're doing is right adjacent to us. How can we partner? Right? How can we further our joint missions by working together? And I think that has been one of the greatest things. It's opened doors. It's given us the opportunity to plan our platform and our products in a different way, where we're like, we don't have to solve all the problems. We know a great company that's doing that. We just need to plug in with them. So that's been really great. I think the mentorship, one of the unique things that we've seen is that as we've worked with Google, for example, or New Schools Venture Fund, even Mass Challenge Health Tech, we've been exposed to just fantastic mentors and more senior people who've done it before. And mentorship is so critically important. It's even more important for youth than it is for somebody of my age, but it's still really important for an entrepreneur to have the person who's gone before and done it and solved some of these problems to say, don't step over there, go this way, and here's why. That's just an invaluable thing, so you're not making mistakes that other people have made. So I think those two things, the communities, the mentorship, obviously the funding is nice. You need that as a startup. That's one of the, I think, important things in this space of sort of social impact. Things don't happen fast, right? And so you need funding to, not only sort of survive and grow, but be around for the opportunities when they come. So solving that funding problem continues to also keep me up at night.
And regarding that mentorship component that you mentioned, are there any lines or like, I guess, things that you carry with you on your day-to-day, like helping with Welfie, that you've heard from a mentor, like a tagline or something that you just try to keep at the forefront of your innovative process?
Ooh, that's a great question. I think the thing that I always go back to is not necessarily a mentor. No, he's a mentor. He's a basketball coach I had in grade 8 at a camp.
Oh,
And he wrote something on this card that said, live an extraordinary life. And I always remember that, because being an entrepreneur is a lot of risk, and being a doctor is a lot of risk aversion. And so it's a really interesting balance as I make decisions for the company, for myself, for my family, and how all these things interact. Is I kind of go back to that thought of like, it's really easy for me to walk a path that is pretty laid out, right? Be a hospitalist for 40 years and have great impact. Don't get me wrong, I'm a hospitalist. I love it. My colleagues do fantastic work. We do fantastic work. But is that the extraordinary life that I want to lead personally? I don't think so. Does it fulfill me fully? I don't think so. That's why entrepreneurship, I think, has drawn me. Is why solving this problem in the community has drawn me. And so that, frankly, is one of the things that like always stays in the back of my brain as I make decisions. Is like, is this going to lead to an extraordinary life? And I do want to define, like, extraordinary is different for everybody, right? It's not about house on the beach with nice cars in the driveway. Extraordinary could be like, I get to spend 8 hours a day with my family and not have to work 8 hours every day, right? That is an extraordinary life for a lot of people. And so however you define it, I guess, I'll leave it at that. But for me, that's kind of one thing that sticks with me.
Awesome. And I really appreciate, like, the emphasis you've placed on the extraordinary life, mentorship, partnership, as well as not having to reinvent the wheel as an entrepreneur, which I don't know if any of us can really like make it through entrepreneurship without at least reinventing one wheel and then saying, oh, wow,
Yeah.
could have found somebody to tell me how to do that.
Yeah.
But if we switch gears a little bit, what would you say have been your biggest challenges or biggest pivots in making Wealthy? Because you've been around a lot. And just for the audience who might have the assumption that entrepreneurship is linear and that you just know all the right things to do or you fail, as opposed to most of us, we're in this middle ground.
Yeah. I think biggest challenges has been trying to convey a public health story in a space that is not used to public health philosophies. And so I'll dive a little deeper on that. When you're in this startup and entrepreneur space, so much of it is about point solutions, right? So what type of app are you? We're a blood pressure app, right? What type of company are you? We solve diabetes for type 1 diabetics. It takes into consideration just the condition, not the person. And so when you start to center it around the person, it becomes, okay, you're a child with type 1 diabetes and you don't have access to food. So now that's a social determinants of health issue. And your metabolic health is tied to your mental health. And so now that's a mental health issue. Plus, we have to deal with, access to, let's just say, electricity, and you can't get your homework done, right? That's a whole person that you're dealing with. And it's really tough for, frankly, investors and people in the entrepreneur space to understand that you want to solve for a whole person and how these things interconnect. Because I think the industry pushes you to say, like, pick one of those and stick with one and scale with one and be that company. And then maybe if you're lucky, you get to, move to number two. But it's kind of like pick type 1 diabetes, solve that, and just do that. So I think that has been the hardest part because I don't think you can be a product that solves for a whole person. I think you do have to be a platform and you have to integrate and bring in different solutions. It's one of the reasons we try to stay away from being a point solution and really focus on the health education and care coordination, because that sort of is more of a peripheral layer, so to say. Or frankly, I'd say a core layer, and so the point solutions are more peripheral, frankly. And so I think that has been the hardest thing. And I think even though that remains our vision, we've had to adapt how we tell our story. And so, in a space like this, public health, I think there's a lot more acceptance of sort of this just multiple things you have to solve for. But I think when it comes to transitioning this into the entrepreneurial space, venture backed, et cetera, it's taken some education and also just it's hard to find the people who get it. As opposed to like the investors who get it or the, champions and mentors who get it, as opposed to the people who are like, I need a, 8-word sentence of what you do. Right. So I think that's been the hardest thing to do.
Absolutely. And I do wonder, like I know there's been some resistance to the way certain things are, like in terms of companies that get the venture capital and whether or not these ways of doing things, the 8 words or whatever the case might be, for your value proposition, et cetera, whether or not they're actually like preventing, companies, like yourself or other companies from really flourishing and thriving because they have a certain way that companies have to fit that mold.
Yeah, I think it makes it tougher. How do I want to put this? I think it's a negative and a positive. For example, we literally just last night had a 2-minute pitch. And unfortunately, we didn't win. We came in second, but I heard it was a close second. But the experience was amazing. It really was, because what I had to do was get our company condensed down into 2 minutes. 1, 2, I had to do it in 8 slides. I had to tell an interesting story about myself, pitch the product pricing, and all these things within 2 minutes. And that exercise is still really valuable because regardless of what you do and how complex it is important to boil it down to something simple and something that people can feel and touch. The 3-minute video I showed was our point solution, right? It wasn't Wealthy writ large and what we want to do as a large vision is what we want to do in youth mental health right now. Had you asked me to demo a year ago, it probably would have been very different. But that's something that I've learned, right? Is you have to have that hook, whether it's a personal story or if it is that 8-word elevator pitch. Like you do need to figure that out for yourself and for your company, and figure out how you want to draw people in. And I think the hardest thing that I've had to learn is knowing when to adapt the storytelling for who the audience is. And so if it's the general audience, the youth mental health focus on vibes really works. For this audience, I would have actually felt comfortable leaning with like, hey, we're a health equity platform. This is what we want to do. because I think there's the audience, making some assumptions here, but the audience is in line with that thought. So I think those are really important skills that I've had to learn along the way.
I love the examples that you gave. Have you used, I guess, not like a group, but like running it by students and hearing what they think very directly? Like, have you made pivots based off of that?
Yeah, there's sorry, I'm smiling because it's not public yet, but we had this amazing customer discovery opportunity with a group of schools in LA, Da Vinci schools. I mean, you know them. And so we were there about a month ago, and there were all these amazing findings from the experience. And so one of them was for younger kids. One of the things that one of the adults in the room observed is, as opposed to a song with lyrics, they were really enjoying and engaging with like making sounds with their mouth and seeing like a biofeedback of like a volume meter going up and down. And when you look at the science behind that, one, there's a lot of science behind biofeedback. There's also growing science around sort of vocalization, humming, and all these other things as a feedback mechanism to decrease anxiety. And so it was one of these things that I started looking at to say, like, could that be a way that vibes are created? That it's not necessarily lyric and affirmation based, but more melody and like humming and vocalizations. And then it really opened up this like equity epiphany for me where I was like, this could work for any age group, one. Two, it could work across languages and cultures much more easily than if I write a song in English and then that has to be translated to Spanish or something like that. And so it was a real, like, we haven't figured it out yet, but it was one of these epiphanies where I was like, from an equity perspective, even though I love hip hop and I love songwriting and all of these things, this is perhaps the most equitable way we could create vibes. And that came from, I think, like a 7-year-old, right?
That's
And so,
amazing.
yeah, it's just an amazing, kind of realization. And so I haven't figured out how to do it, but I was laughing because there's a song that I'm writing where I'm trying to like layer in these things. So there's a lot of humming and sort of melodies in the song because of that. And that if you stripped away the lyrics, ideally the humming and like the melodies in the song would be enough to provide a layer of, intervention or prevention, so to say. And so I think it's going to even impact how I'm writing songs, which is kind of fun and exciting. But it's kind of that feedback loop of, you see something, you observe something, somebody tells you something, how you build that in the product. One of the things I'm hoping to do later today is sort of send it back to this group of kids and be like, what do you think? Right. And so, yeah, it's a really exciting sort of time for us as we're sort of in this experimental phase.
Dr. Moyo, I had a quick question about just this is a wonderful like service for kids and having them really think about their wellness, and a Welfie is so clever. But I was just wondering how your company is addressing concerns that parents might have or educators in terms of privacy for kids or protecting their identity and their data. Because obviously that's something that's been in the news, when it comes to
Yeah.
being used by younger people.
Yeah. I mean, I've been thinking about this since day one. My viewpoint is that everybody's health data is their data, right? And I think that's how our system talks about health data. It hasn't been how it's been, right? We just had to pass laws. I think it was in like 2 years ago. ONC passed some laws that if you're a hospital system and you have this health data, you have to make it available to patients within like 90 days, right? If they request it. It used to not really be that way. Like health data sort of lived in these silos, and whether it was a lab or a hospital or whoever, they kind of had your health data. Not that you couldn't get access to it, you could, but it was very difficult. And so the way that we try to approach it is, one, as families connect to different systems, that the health data lives on their device, it is their data. So they get to choose who they share it out with, right? So if you want to share it with the school, it's a simple toggle on off of whether the school gets access to data. If you want to share it with a specific doctor, it's a simple toggle on off. And so you can see who's accessing the data, like which institutions, who in the institution, and ideally why, right? And ideally you'll know that sort of inherently. My pediatrician is caring for my son, so yeah, I know why they're accessing the data. I think that's really important. I think the other piece that's really important is once this data gets aggregated is having transparency about what's done with that aggregate data. We all send things back to Apple and Adobe and whoever, right, when things happen and our systems crash. Often the times we don't know what happens with that data after the fact, right? So I think having transparency to say, hey, if you're part of this community, we've aggregated this data around blood pressure, it's anonymized, you've authorized for it to be shared with, let's just say it's a pharmaceutical company creating blood pressure medications. Here's how they use the data, here's what they found, and educate people back. Because I think a lot more people are willing to share data if there's a value that they see and they understand how it's being used, as opposed to, oh, now I'm seeing ads for blood pressure medications everywhere I go, right? That's what people really do not like. And so we're not interested in the ad business. We're interested in equity. So we want to use data for equitable purposes. How does it improve health education, improve access to care? And so that's one of the things that's just always going to be kind of a promise from our company. And just making sure people have that transparency. But I don't think we have it solved. I think it's a conversation that we need to continue to have with communities that we care for. And then I think the other really important piece is so much of the data conversation is obscured in like legalese, right? Terms and conditions get signed. It's a 36-page document, which nobody ever reads. Like, how do we just make it really clear and honest? Like, if you share your data with us, these are the good things we want to do with it. These are the bad things we won't do with it. And this is how we'll report it back to you. Like, it needs to be a simpler and honest conversation.
Thank you very much for sharing. I really appreciate that. It's such an important conversation, so.
Yeah, it's critical. It's very critical. And I think the one piece I'll add as well, which, hopefully some people caught, is it's not only the parents' consent, but it's the students' or youth's consent as well, right? It's their data. And if they don't want their vibe analyzed for mental health purposes, they can toggle that off. They can still create a vibe. They can still, keep it private. They can still share it is the goal, but we'll not analyze it unless you want us to, right? Because some people might not want that. And I think as opposed to a lot of systems where it's like you have to opt out of that sort of analysis, we want people to say like, no, I don't want that to happen for me, and just be very upfront about it.
No, it's a fascinating subject. Thank you.
Yeah, I mean, throughout this whole conversation, though, Stephen, I'm just reminded of like just how multi-layered it is, right? You're not just creating a mental health app for kids where they, as you showed in the demo, where they get to play fun songs. It's so much deeper than that. There's so many aspects, right, that you are thinking very judiciously and carefully about. And so I wanted to end with the last question before we hop into Q&A. So I think Emmy had asked you like some life-changing advice that you may have received. But on the flip side, what life-changing advice would you give to the audience or other people who will watch this webinar in the future about what it's like to do what you do, straddling that fence of being a physician entrepreneur, or in some cases, a healthcare entrepreneur, and thinking about health equity, data privacy, and other things?
Yeah, I think the advice I give individuals who are thinking about entrepreneurship is to just start it and just do it. If you, and I think this is especially important for physicians or people who are in academia, where our thoughtful selves get in the way of action. And because we're, risk averse, overly cautious, often that will lead to inaction or overcomplication, right? I got too many people involved. There's too many, competing interests at an early stage, which can kill dreams. And so there's I don't know if we have the time later, maybe I'll do it, but there's a simple sort of framework that I've tried to start using around entrepreneurship. And the first one is like giving yourself a permission to dream. Like, think up that crazy idea and give yourself, like, quiet that voice in your own head. Give yourself the permission to dream about like a world you want to create. And then once you buy into that, there's aspects of sharing with other people and getting that idea beat up that are really important for entrepreneurship. But once you give yourself that permission, it's like moving towards certain action steps where you check off a box of like, oh, I created a pitch deck. Might not be the best pitch deck, but here's a pitch deck. And I shared it out with friends, right? Like that's a big dive for a lot of people. Like, to get that idea out of your head onto paper and out into the world, just make it happen. Do it in a weekend. Let it be messy. Nothing is perfect. We've had countless amounts of pivots and iterations, and every good company does. And so I think, yeah, just that aspect of like, think about action and impact, sort of immediate, and don't get in your own way is really important.
Oh, that's amazing advice because like so often we get caught up in just wanting to do something so perfectly, and the stress of that will inhibit you from even starting. That is amazing advice, Dr. Moyo. Also, like a great transition into us taking questions from the audience. The first one that I'm excited to ask you is an anonymous attendee asked, Dr. Moyo, how does your Welfie app utilize community health workers?
Yeah, that's a great question. We are really trying to build a tool around community health workers. So even what you saw with Vibes, frankly, that perspective was from the student. But the other side of that is imagine you're a community health worker. And we utilize the community health worker as a pretty general term. That could be a behavioral health coach, peer counselor, somebody who's based in the community. There's that opportunity to be able to send Vibes as a health education tool. That ability to utilize what you captured with the assessments that you send to that youth to address care coordination and plug them into the right care. Because if it is, Maria who's there and you're the community health worker on the other end, Maria might be having a bad day because she's struggling with tests in school, and maybe she needs some skill building content, which you could find on Welfie and in the Well. Or maybe she's been having this for the past month, and hey, this could be depression. Let me send her a PHQ-9. Let me plug her in with her pediatrician and get that care. And so Vibes is sort of the youth engagement aspect, but I said we're building a platform. There's a product that we're building that's called Welfie Hero. Hero for us stands for Health Equity Response Organizer. These are the community health workers, behavioral health coaches, et cetera. And we're building that tool, Hero, really around the community health workers. So for any community health workers in the audience, please reach out to me. We'd love your feedback. We wanted to co-design it with you. We're co-designing with some community health workers here in San Diego, but we can never have enough voices at this table when it comes to community health workers.
That's really interesting that you just had that response, because one of the questions in the Q&A was, are you currently hiring community health workers? So yes, that was it.
Yeah. We want to. It is one of the line items as we try to fundraise. So let's please start a conversation and build a relationship, because as we try to impact these communities, as I mentioned, community health workers are like, I'm a cheerleader for them. So I'm here to support and sort of try to make sure we remove as many barriers to them having impact, and then also having longevity, which I think is really important. There's a lot of turnover in the space. How do we better support community health workers? Because they just do so much for the health of underserved individuals.
I'll bounce on to the next question. This is an interesting one. What does this Welfie look like as a course in a cognitive science department such as MIT?
Ooh, that's really interesting. I think I don't fully understand the aspect of a course as a cognitive science department. If they can sort of I can sort of take some guesses for what that would look like. I would say that, if we're thinking about what would Welfie look like at a higher education institution, I actually think would live more within sort of Masters of Public Health, even medical school, perhaps even business school. And the reason I'm intersecting all of those is because that's what Welfie is. We're a for-profit health equity platform, right? And my crazy vision, which I haven't shared on this, is to have Welfie be what I call a public health utility, right? This is something that whether you're a school, you're a payer, you're a government, this is the platform you can reach to deliver health equity to a population. And if you're a part of that community or that population, it's a platform you can reach to get health equity for yourself. And so there are foundational aspects around public health, around what that means like for government, for business, where it's very intersectional, that I'd feel that that's where it would live in a higher education institution. But yeah, I know that doesn't fully answer the question, but best shot I can.
Very interesting too. And I happen to do a good amount of cognitive science, and even I was not quite sure that could be answered. But yeah, Emmy, did you want to do the next one?
Yeah, that sounds great. I was looking at the next one, and there is someone who's interested in applications for air quality monitoring. And I guess with regards to like health disparities, how do you see Welfie helping with something like that? The question is mostly like focused on this air quality monitoring app, but I'd like to see how Welfie has like interactions with health disparities.
Yeah, this is an idea that we've had, and we've talked to a air filtration company about this. Talked with actually a couple of organizations around this, which is as we think about pediatric population health in schools specifically, Harvard School of Public Health has some great research around this, which is how air quality actually impacts cognition, the ability to perform in a school setting. And so for us, as we think about Welfie as kind of the school-based health platform, there's this aspect of being able to monitor that Welfie for a student includes their mental health, their physical health, plus environmental health, right? And so it's everything from that air quality within the building, air quality outside of the building. And this is really important when you look at pediatric health, because the number one issue for admissions to pediatric hospitals, costs for pediatric hospitals, are respiratory issues. When you look at why students miss a lot of school, it's usually like asthma, allergies, and things like that. And so if you could actually start to solve for these problems, there's a real ROI opportunity for providers and payers. But there's a real aspect of for schools, which is about increased attendance, increased academic performance, where there is science that shows that improving air quality, noise pollution can allow students to be able to concentrate more and perform better. So towards our point, which is we're not going to build that solution. So we'd love to partner with companies that are doing that and be able to really tie the story together, right? Because there's data that if you're an air quality or noise pollution company that you're capturing, that if we can tie to test scores is really important for schools to understand. And because we're integrated into health and into education, we feel like we can be that hub to tell that story.
Oh, that is so exciting. And I'm kind of an EHR nerd, so like knowing that there's that much data that you're going to be able to work with, that's amazing. There's a lot to look forward to. Candace, did you want to take away the next question?
Well, I was going to be very cognizant of the time, given that we're coming at the end, and I know some people may need to go. No, it's totally fine. Dr. Moyo, this has been an incredibly enriching conversation. I know I've learned a ton. I've been inspired myself and everything, that you've mentioned as well. But I'd love to give, some final words to Dr. Cersei, Emily, and then Stephen, if you had anything else you wanted to say at the end.
Well, I feel like we've gone on actually just scratched the surface of what is such a major undertaking by your company. And it really contributes to an obvious gap in service delivery for a population whose mental health tends to be overlooked and obviously has been so incredibly impacted in the past few years, whether it's because of COVID or school shootings and the like. I mean, this is obviously incredibly innovative. We were saying at the start of this call and beforehand how much we wish we had something like this when we were kids. And it certainly makes me personally feel better to know that this type of technology is in the works. And when we think of innovative public health technological apps, this is the type of thing that comes to mind. So I just really appreciate you being here with us today. And I think if anything, this conversation really illustrates that there's just no one piece, as Dr. Carpenter was saying, there's just no one piece in this conversation that's more important than the other. It really all goes together. But I want to hand it back to my colleague.
Yeah, Emmy.
I'm honestly just excited. Like there's with biodesign, with biotech, and having like a health equity facing component to it, where it's like it's the foundation of what you're doing and not just added on as an afterthought or something that could be brought onto your platform. That's the whole reason we're doing this. And like I'm only a couple years out of undergrad and seeing that there's founders like you who have like mission at the heart of everything you do. The whole reason we're doing this. It's incredible. Thank you so much for joining us, Dr. Moyo.
No, well, thank you for having me first and foremost. I guess any final words I'd say would be two things, and I think there's a similar line. I mean, I think you're the first person I've heard call themselves an EHR nerd, so we'll talk more about that. But that same invite I give to you, I think I give to everybody on the call. My email is docmoyo@welfie.com. I'm heavily present on LinkedIn. That's the best way to connect with me, if not via email. And what I'll say as kind of a call to action to all of us is that whether you want to help with our mission or frankly, if we can help with your mission, please reach out. We are very collaborative at Welfie. We know that this work, frankly, is going to take a village. We don't think we have all the problems solved. And frankly, we don't want to solve all the problems, but we want to be connective tissue for each one of us who's doing this work in the space. And so please reach out. Let's build community. Thank you for being here, and thank you, Dr. Carpenter, Cersei, for having me. This has been just an amazing experience for myself, and so I really appreciated the questions and the conversation.
Thank you.
Awesome. Thank you so much. And for our audience, thank you for hanging out with us till the end of the hour. We will be sending out those certificates to you within the week, and make sure you join us next week, as well as some other dates in May, always on Wednesday, for our Biodesign and Public Health series.